Hello, everybody, and welcome to this Facebook Live on flu and COVID. A lot of people have been asking us about that because as the Northern Hemisphere enters flu season and as the globe is still managing the COVID pandemic, people are wondering how can we as individuals and how can our health systems manage two diseases at once. My name is Nika Alexander. I'm part of the communications team here at WHO, and today we have two people joining us. Dr. Sylvie Briand, who's the Director for Global Infectious Hazard Preparedness. Welcome, Sylvie. And Dr. Ann Moen, Chief of Flu Preparedness and Response at WHO. Thank you both for being with us today. We are at home. New measures have come into place in Switzerland recently, and so we are working remotely as much as possible. Sylvie's in the office, however. So just to start off at the top, Anne, I'll ask you the first question. What kind of flu season did we see as the Southern Hemisphere had their winter and went through their cold months? Oh, it looks like Anne's connection might have dropped off for a second. Sylvie, can you jump in here? What kind of a flu season did we see this year?
I'm back. I caught the question, so thank you for that question, Nika. In the Southern Hemisphere, we saw an uncharacteristically very mild, low circulation of influenza. And we think in part this was maybe due to the public health and social measures, washing hands, mask wearing, staying at home. We saw very little flu in the Southern Hemisphere in the past season. Nonetheless, we're preparing countries and people to make sure that we keep an eye out for flu in the upcoming Northern Hemisphere season. So we need to do all the routine things to prepare, and including using the public health and social measures that work so well for COVID, continue to use those because it may also help prevent the flu.
So we'll talk about that in more detail if people didn't catch all of that in this at this one time. So Sylvie, can you just recap for us? We say public health measures. I know you're not a fan of saying non-pharmaceutical measures, but what does it mean? What is it that people have been doing that societies have, we think, perhaps managed to control flu at the same time as we are trying to control COVID?
Yeah, what we know now is that flu and COVID-19 are both respiratory virus primarily, and so the mode of transmission are similar. And so they transmit by droplets, respiratory droplets, but also contact. So when each individual implement personal measures such as washing hands, keeping physical distancing, and also trying to avoid places that are indoor, crowded, where they have close contact with other people. It reduces significantly the transmission of COVID-19, but also flu. And so those measures are really good for both viruses and protect us similarly. But there are other measures that can be put in place also, and we have seen them put in place during severe influenza season as well. Is, for instance, event that bring people together and mix people from different origin. That increase also the transmission of the virus, like mass gathering, whether it's religious, sport, or any other mass gathering. It increases also the transmission of those viruses. So that's why the measures that were put in place for COVID-19 were extremely efficient on COVID-19 transmission, but also are very efficient on influenza. And it's probably the reason why we have seen such a limited circulation of flu in the Southern Hemisphere.
We say they've been very efficient, but we are in the midst of a global pandemic. So we together as the global community have not yet managed to control COVID. So that's just something that we're still all working on. We know the measures that work. It's just not as easily said, not as easily done as said for every individual, every country, every health system to put in place everything that we know can work for now, and at least controlling, if not completely stopping the spread. We are on Facebook Live, so if you have questions on Facebook or LinkedIn or YouTube, drop us a question in the comment section. On Twitter, you can use hashtag AskWHO. That's how we always take questions for these live events. We have our first question on LinkedIn. What are some symptoms which can distinguish flu and COVID? And that, I think, is the million-dollar question. That's what everyone is wondering when they get a tickle in their throat or they're feeling a little bit tired. How do you know? How can an individual know if they have flu or COVID? Anne?
So that's a great question. So first of all, the only really definitive way to know whether you have flu or COVID is to have a laboratory test to find out if you're positive for flu or for COVID. So that's the definitive way to know, because the symptoms of both flu and COVID are quite similar. Respiratory symptoms. However, COVID does have a couple of very unique symptoms, such as loss of smell and loss of taste. And there's a good probability that if you have one of those, you're more likely to have COVID than flu. But really, we don't need you to self-diagnose. What you need to do is check and see if your symptoms, keep an eye on your symptoms. If they're mild, sniffles, sneezes, no fever or low fever, you can stay home. But if you start to have severe symptoms like shortness of breath, high fever over time, and other symptoms which are severe, you should seek medical attention. And that's the best thing to do, is to keep.
We just lost Anne. I think she'll come back. I just want to reiterate the symptoms that are similar, which she said off the top, include cough, sore throat, fever, fatigue. Doctors call that malaise, so just feeling unwell. Anne, you're back. So you were listing the kind of more severe symptoms for which people should seek care. It doesn't matter if you think you have COVID or the flu. If you have these severe symptoms, you should seek care. Can you just go over what those more severe symptoms are?
Yes. If you have trouble breathing, shortness of breath, high fever, malaise, you can't get out of bed. If you're very severe, you should seek care. If you have maybe just mild runny nose, mild sore throat, and sniffles, you can stay home and treat your symptoms. However, if you're a high-risk patient, if you're pregnant or have underlying conditions and you're not feeling well, you may seek care in either case, just to make sure, and get a test just to make sure. Because if you are one of those high-risk patients and you have flu, there are antivirals that can be used to treat you. And so basically, the bottom line is, if you're severe, you should always seek care. If you're mild but have an underlying condition, you may want to check in with your doctor.
Can you just go over, Anne and Sylvie, you can supplement if we need to, who those vulnerable groups are? Just recap those. Vulnerable, particularly vulnerable for flu, meaning people who might have worse flu, for whom flu is more dangerous.
Sure, Nika. So for flu, there's 5 risk groups. There's children under 5. There's people with underlying conditions such as diabetes or heart problems. There are the elderly. Anybody over 65 is considered high risk. There's health workers are at high risk, mostly due to occupation, and also we want to prevent their spread. And then the elderly.
The pregnant women.
And
pregnant women. Thank you, Sylvie.
So the very young, the very old, people with underlying conditions, and pregnant women.
Yeah, and I think this is what's very important, because for flu, we do have treatments. We have antivirals, and it works. So for those high-risk people, it's very important, especially pregnant women, that if they have they think they might have got flu, they go to see their doctor, because there might be a solution for them to maybe not completely treat the flu, but at least prevent them to have a severe form of the disease. And so that's why it's important to have early treatment and early medical attention.
We're getting questions now on vaccines, so that's another topic we want to make sure to talk about well today. The flu vaccine. Who should people get the flu vaccine? First question, during this COVID outbreak, when people are being told, for example, to stay home, should you go and get a flu vaccine?
So I'm happy to take that one first, and Sylvie might supplement. Absolutely. If flu vaccine is available for you in your country, you should seek the vaccination. Different countries have different policies, but WHO recommends vaccination for all of the 5 high-risk groups that we just mentioned. So that's pregnant women, health workers, the young, the very old, and those people with underlying conditions. And so absolutely, flu vaccination is the absolute best way to prevent influenza, and we're very lucky to have a vaccine that works pretty well. And so we do recommend that if vaccines available locally and you're one of these high-risk groups, you should seek influenza vaccination to prevent seasonal influenza.
Or even if you're not in one of those groups, if it's available and recommended wherever you live, then yes, take that opportunity, take that chance to protect yourself and also protect you from carrying the flu virus and maybe passing it along to someone else. Yeah. I think people may have heard us and other health agencies recommending that people get the flu vaccine and might be a little bit confused and wondering if the flu vaccine somehow protects you against COVID. What do we know about that at the moment? Sylvie, what would you say?
So flu and influenza viruses and COVID-19 virus, SARS-CoV-2, are different viruses. So, and the flu vaccine is based on antigens that are specific from the flu virus. So so far we haven't seen that the flu vaccine can protect against COVID. But what is for sure is that if people get flu, somehow their immunity is weakened. Because they have to fight already the flu vaccine, so the flu virus, sorry. And so it's very, they make them more susceptible to get other type of infections, whether it's from bacteria or other viruses. So that's why, I mean, the flu vaccine in itself will protect you predominantly against flu, but also will help you to go through the autumn and winter with less vulnerability to other types of infection. So it's a safe vaccine and it prevents a flu effectively and probably also protects you against other infections. So I think it's really good to have it if it's available and if you have it, if it's a part of the policy of your country.
Staying with you, Sylvie, we have a question as well on treatments. So we asked whether the flu vaccine protects you against COVID. As far as we know, it doesn't, but it protects you against flu rather effectively. Are there any treatments for COVID that have been found to be useful, or no, are there any treatments for flu that have been found to be useful for COVID? They're different viruses, but have there been any treatments that work for both?
Yeah, so there have been a lot of studies to see how we can repurpose antivirals that are used for influenza and if they would be effective on COVID-19. And so there are different studies that are ongoing. Some of them have been published. And so, so far there was some effect of certain drugs, but they have to be administered very early on in the disease, the first day, to be really effective. And so many studies have studied those more in hospitalized people when they are already in a severe phase of the disease, and it's long time, I mean, few days at least after the onset of the disease. So now we need to also look at how to study those drugs, but really in outpatient, not only in hospitalized people, and at a very, very early stage. And this requires, of course, as Anne mentioned, it's very hard to differentiate flu from COVID based on the symptoms. So we need also to have the capacity to test people at a primary healthcare level or at GP level, so that we can immediately also test if those flu drugs can also work for COVID. So this is work in progress because, as you know, the science has been very fast since the beginning of this pandemic, but we are still learning on this virus and we are still looking for good tools to fight this virus. And so flu treatment are part of those tools that we are currently testing.
So that's what we're currently looking into. So the answer is we don't know if there's any treatment for flu that also works for COVID. What we do know is there is a corticosteroid called dexamethasone, which has been shown to be life-saving for some people who are the sickest with COVID. So people who are in hospital, taking oxygen or under ventilation. Studies have shown that dexamethasone is life-saving and can alleviate some illness for those people. So that's the only thing we know of at the moment. We have a question from someone who's asking, if you have had COVID and recovered, is it safe to get the flu vaccine because your immune system has already, quote unquote, been triggered? So I guess it's sort of a technical question. Wondering is, in a way, are you tiring your immune system if you are recovering from a disease and then get a vaccine against another disease? We lost Anne again. So Sylvie, it's over to you.
Well, I think as we said, these are two different viruses. And although this triggered your immune system, they may trigger different part of your immune system. So we are still learning on COVID immune response. But so having had one disease, of course, has produced and made you produce antibodies against this virus, the COVID-19 virus, but doesn't make you produce antibodies against flu. So having the flu vaccine will increase your protections. And so that's why we recommend to have the flu vaccine, even for the people who have had COVID and more specifically the people who have are at risk for flu. Also, we really recommend them to get even more prevention and to boost their immune system against flu as well.
From what we know at the moment, and this is just to clarify and related to another question, having one disease does not make you immune to the other one because there are different viruses, different diseases.
Exactly. I mean, the vaccines are usually developed really to target one specific virus because for two reasons. First, because it elicits stronger immune response and gives you better defense against this virus. But also it's because we think that it helps also the production, because in the vaccine we put one antigen, and so then we know the reaction are against this antigen in particular, and so it's for those two reasons, because it will give you a better defense, but also from the production capacity it's much safer to focus on one antigen. This is why a vaccine usually protects against one virus only. Sometimes you can put in one vaccine different antigens so that you are protected against many viruses at the same time. But usually this is done when we really know what happens with each of these viruses. And so that's why the flu vaccine currently protects you against flu, but not necessarily against other viruses.
Similarly as well, there's a question too, would you test positive for COVID if you have flu in your body, or would you test positive for flu if you have COVID in your body? But building on what you've just said, Sylvie, the answer is no. The tests look at whether you have, depending on the test, whether you have this specific virus in your body or the antibody towards that virus in your body, and they're different, the ones for COVID and the ones for flu. Correct me if I'm wrong.
Yeah. Anne can comment on this. Now we have a new platform for diagnostics, and maybe you want to comment on the multiplex.
Sure.
Oh.
Yeah, we're having bad connectivity.
So Anne, yes, please.
There are new laboratory tests out there that can test for flu and COVID at the same time. So they're specific for COVID or specific for flu, but you can run the test at the same time. So this will be very good for public health situations and maybe surveillance situations where the laboratory only has to do one test and they can find out, do you have flu or do you have COVID? And there are other instances of this. There are some tests that test for even more pathogens than that. So they're called multiplex or multi-pathogen tests. But if you have flu in your body, they're only going to find flu. If you have COVID in your body, they're only going to find COVID, and they don't cross-react. However, it is possible, as Sylvie said, to test for both at the same time.
Thanks, Ann. And while your connection is still stable, we have a question from Kim Russo on Twitter asking how long the flu vaccine is good for. If I get it today, how long am I protected for?
So the flu vaccine.
So that's frustrating. Oh, looks like we've lost both at the same time. So I think I can answer this one.
I'm back. So people get vaccinated right before the influenza season, and that takes you through the full season. Every year the flu vaccine changes because the circulating strains change, and that's one of our major public health priorities and one of our major public health obligations at WHO is to help conduct surveillance year-round to see what new flu viruses are circulating. And then we use that information to make expert decisions about what should be contained in the next year's vaccine. So the vaccine will last until the next season. And that's why people have to get revaccinated every year, because flu changes and mutates very rapidly. And every year there's usually some new components in the flu vaccine.
So you're protected against whatever strains of the flu was in the vaccine you were given. But every new year, there's different flus, as it were, circulating. So you need a vaccine. It's not so much that your vaccine has that the immunity in your body expired, but that you have immunity to different, old flu strains, and there's new ones going around now. Is that a good layman's way to summarize?
That's correct, Nika. And there is a waning immunity. The vaccine does, over time, become less effective as you get further and further from your vaccination date. But that's also why we need to get revaccinated. Sometimes some of the components in the vaccine are the same, but usually there are some new ones, and we need to get revaccinated to protect against those new strains.
Okay. Here's another question for you. It's actually just down to the two of us for now. It looks like Sylvie's having a bit of trouble rejoining us. We'll try to get her reconnected. What could Northern Hemisphere hospitals look like if there is an intense flu season? I know we don't really like to speculate, so what I'd rather talk about is what is WHO doing to help health systems prepare in the north, from what we've learned in the Southern Hemisphere, helping countries to prepare for this upcoming flu season.
Well, if you were on earlier, you heard me say that the Southern Hemisphere was historically low flu circulation, but flu remains unpredictable. So we're asking every country to prepare and gear up for a normal flu season in the upcoming Northern Hemisphere. So that means continue to conduct surveillance, continue to vaccinate and get vaccinated if you have vaccine available in your country. And we're also at the same time, because of the possibility that flu and COVID could co-circulate, we're reminding health centers and doctors and hospitals to make sure they have enough PPE and supplies, to make sure they have the plans for surge capacity to treat extra patients if they need. But I think the best thing that you as an individual person can do is follow the control measures. Try and make sure you follow the public health and social distancing measures, like washing your hands, staying out of large crowds, like Sylvie said before, and getting your flu vaccination if it's available, because we want to do everything we can to prevent illness and keep people out of the hospital. So while hospitals are preparing to gear up, as an individual, you can do your best to try and prevent illness and follow your local guidance.
There's a question here on whether ginger and garlic is helpful against flu. So I guess that's a treatment question.
I personally don't know of any studies that say ginger and garlic are helpful against the flu or others. I mean, there are quite a lot of traditional medicines, and I think that they're fine if they're also applied with the other medicines recommended by your doctor. And of course, if chicken soup makes you feel better, have chicken soup. But we really try to stick with medically established, and there are some studies in some countries that do use some traditional medicines, but we would couple those also with other treatments, antivirals, vaccination.
And I think it's important to make the distinction as well. We're talking about if you're having milder symptoms and you're caring for yourself at home, then you can take whatever makes you feel better, eat whatever makes you feel better. But in terms of medicines, those should only be used under advice. And if you start to feel worse, as we had outlined earlier,
go to the doctor.
Medical care, yeah, especially if you're in one of the more vulnerable groups. Sticking with the flu vaccine, and this could be quite technical, but I know you were part of that strain selection. You were talking about how every twice a year, WHO looks at the circulating flu strains and makes a very scientific guesstimate, if you can use those two words together, as to what we think the circulating flu will be in the upcoming Northern Hemisphere flu season, and then the Southern Hemisphere and Northern, and so on. So for this upcoming flu season in the North, do you recall what strains we thought would be circulating?
So Nika, you got me. I'm not. That's not seared in my brain. So I can't tell you exactly what the components in the upcoming, in the current vaccine for the Northern Hemisphere are. But I can tell you that vaccination is the best way to prevent.
Look at the various flu strains. When they meet, then we publish what they've summarized on our website. That's what industry uses to put together the flu vaccine. I can answer a fair number of questions, but I don't want to carry this Facebook Live by myself. And I think, Ann, you're in and out, and Sylvie's in and out. So, and we're also at the half-hour mark of being together here. There's more. We'll be posting more and more information on precisely those main questions that people have been asking us about, how you can tell the difference between having a cold, allergies, flu, COVID, when you should seek care, what those more severe symptoms are, what the vulnerable people are. So keep your eye on our social media platforms in order to see that information. And Ann, I'm just going to let you pop out to say goodbye. And Sylvie, I don't know if we can hear you, but first we'll start with Ann. So any parting comments for people who are watching now?
So my parting comment is just to do everything you can to stay safe in these challenging times. Follow your local government's guidance on mask wearing, washing hands, social distancing, staying out of crowds, and do what you can to prevent the flu. And thanks for joining today.
Thanks, Ann. One thing we didn't mention today, but we do mention other times, is staying out of crowds. And if you are indoors, if you are in a closed space, as much as possible, keep your distance from other people, but also crack open a window for better ventilation. If you can, crank up the air circulation. If you're in a workplace, there's very technical ways that those who manage the airflow can look at to make sure that the air is exchanging frequently in your space, to make sure any virus can be flushed out with the fresh air coming in. I don't think we can hear from Sylvie either. She's done previous sessions on flu for us as well. We can send out a link for you if you want to hear more of what Sylvie has to say about flu. Thank you for joining us today. Apologies for the technical difficulties. That's one of the challenges when we're working from home, but I think it's worth it so that we can all stay safe. And please join us next time for our next Facebook Live. Keep your eyes on our accounts for what the topic will be. Thanks, everyone. Bye-bye.
Thank you, Nika.
Thank you, Ann. Thank you, Sylvie, even though you probably can't hear us.